What advice do you want to give parents right now?
So the advice I would give to parents when preparing to send their kids back to school is that for those that are 12 and older, if they're old enough to get vaccinated immediately to give yourself time to be protected before you start school. For those that are under 12 and are not yet eligible, and really for everyone, even including those that are vaccinated, wear your masks in school. We are seeing with the Delta variant that it's twice as contagious as the original strain. We also know that it is capable of causing infection in vaccinated individuals. However, the degree of infection is significantly lower. That most cases are either asymptomatic or very mild compared to those that are not vaccinated. And we're seeing with the Delta variant, really it's impacting kids more so than the original strains had. We're seeing in Houston about 1 in every 10 kids that are COVID positive are being admitted to the hospital. I mean, that's a pretty significant number. And about a third of those admitted are sick enough to be in the ICU requiring oxygen or even a higher level of care. So it's not a truly benign illness for children as what was previously expressed. And we want to do everything we can to protect our children from getting it.
So although schools are not able to mandate masks for kids, you do recommend that parents do send their kids with masks, especially the unvaccinated ones?
Yeah, and especially since the schools cannot mandate in the public school system. So it's so important as a parent to emphasize the importance for the kids to wear their masks, not just to send them there, but to keep them on, because, for kids, that's a hard thing to do. So as a parent, I think you set the example that if you're going to be in public areas, especially indoors, that you wear your mask so that your child understands that, yes, it's mom and dad and me.
And are there any tips for parents, especially the younger kids when they go to school? And I know they had to do it last year, but just maybe practicing wearing their mask before they go to school or just getting used to it?
Yeah, if they haven't been wearing a mask, for a while, I think getting them used to it, because, it is something that's on their face, it's different. But, I find that, with younger kids especially, you can make a game out of it. Make it kind of you're a superhero, or it's something fun, it's something exciting, and that it's cool to wear a mask. And, there's all sorts of masks that you could either buy or make for your kids that are kind of cool looking. And certainly for the older kids, helping them to understand the importance of protecting not only themselves, but your family, your loved ones, your grandparents, aunts, uncles, so that they understand that this isn't just for them, but it's for everyone else around them.
And like you said, we kind of used to say that kids weren't being impacted by this. For people that still think that, what do you say?
Well, I think that they just need to see the data, see the statistics, and believe what they're being told by those of us who deal with it on a regular basis. I mean, it is hard when you've been told something for months, that it's not a big problem for kids. And, again, in the past, even though it wasn't, we did see kids get sick. We did see kids that were hospitalized, but we're seeing so much more of that now. So it's a real thing. And they don't want to be a statistic. As a parent, when you have to deal with your child getting sick, when it's something that you might have been able to have prevented, the amount of guilt that goes with that is just unthinkable.
Yeah, I'd say parents that maybe are hesitant to, I guess, force or encourage their teenagers to get vaccinated, if maybe their teenager doesn't want to, or the parent is hesitant to vaccinate that teenager. I mean, what are your words of encouragement or education to get them to do that?
Well, I think it's important that they recognize the effectiveness of the vaccine. There has been, again, a lot of press now just these last few days that it may not prevent you from getting infected. But what makes a vaccine so effective is that it prevents you from getting really sick, and it prevents you from being hospitalized, and inevitably it prevents you from dying from something that can happen. So the vaccine remains extremely effective for all those reasons. We also know the safety of vaccines. A lot of people worry about, we don't know the long-term effects. And one thing I can really, really stress is that in the history of vaccinations, when it comes to side effects, generally, if we see them at all, we're going to see them within the first 6 weeks. And this is going back for, over 100 years worth of vaccination. And we have now, several months out from when the vaccine was released. So, 30 plus weeks out, and we have over 160, 170 million doses given. So we know what we're dealing with. We know the safety of these vaccines. We don't expect something surprising to jump out at us. And we also know how effective they are. So I think it's important for parents to realize you're dealing with risk versus benefit. The benefit outweighs the risks by an exponential fold.
I was going to say, what are some of the main symptoms or problems you're seeing with the kids that are getting COVID? And then also, what's like the youngest age kid you've seen or heard of?
Well, I mean, we've seen newborns with COVID. So, right out, I mean, literally on day one, they've been born infected. Others get infected, very quickly. So we're seeing it from a very early age. The symptoms, we see fever quite commonly, and now we're seeing a lot of kids with higher fevers than we used to. Coughing, shortness of breath. Those are the things that are certainly concerning. But the classic cold symptoms, the runny nose, the stuffy nose, those are have been frequent symptoms of COVID and still are. It makes it difficult because we see that now with so many other common respiratory viruses that are going around the community that normally don't in the summertime and weren't much last year because everyone was staying home and everyone was wearing a mask. So it's really opened up a whole new frontier for us this summer.
And how this is affecting kids, is that all due to the Delta variant?
It seems that the majority, because almost all of what we're seeing now is the Delta variant. So we're definitely seeing an increased spread, but it seems to be taking a harder toll on children because of the Delta variant. Now, I don't know we have an answer as to why, but that seems to be what the data shows.
Is there anything else you want to add that you think is important for parents to know or understand before the school year starts?
I think it's just important for them to understand that our goal isn't to scare anyone, but it's to give them the facts and let them understand the reality of the risks that are involved with this type of infection and what they can do to prevent it. And again, vaccinating when possible, masking, for everyone in the schools will absolutely significantly reduce the risk of this. And just do that. It's the right thing to do. It's the thing. It's showing love of your child. It's showing love of your family. Showing love of your neighbors to do this. It's a personal choice, but it's a choice to me. It's a choice that we make as a society to protect each other.
And are these kids being hospitalized? Do they all have underlying symptoms, or is it sometimes healthy kids?
It's an important question. Certainly we have seen and continue to see that a lot of the kids being hospitalized have underlying symptoms, underlying conditions, but that could be being overweight. We know how common that is. People don't think about that as an underlying condition. People, a lot of kids have asthma. That's a significant underlying condition. So yes, that's true. However, we have seen many kids being hospitalized now and some getting quite sick who have absolutely no underlying conditions. So that's not a guarantee just because your kid is healthy. Your child is still susceptible, and you don't want to let your child suffer when you could have prevented it.